Hello everyone. Today I'll be describing a video for different surgical techniques for a macular hole. Case of a non-closure of macular hole operated elsewhere 6 weeks back. After fluid gas exchange, I have stained the ILM with brilliant blue dye again. You can make out the edge of the previous ILM peeling done. Here I am using a soft tip cannula to remove any excess fluid which has entered the macular hole. This also helps to reduce the size of the hole slightly. After this, I inject PFCL over the posterior pole, and under PFCL cover, I do ILM peeling along the edge of the previous peeled area. This is my first free flap of the ILM, which I drag with the help of the ILM forceps towards the macular hole along the surface of the retina. Then I use the forceps to stuff the ILM inside the hole. However, it is not enough to seal the hole completely. Therefore, I do another small ILM peel along the superotemporal arcade. I roll this ILM into a taco-like formation, and then I use the ILM forceps to gently roll this piece of ILM along the surface of the retina towards the macular hole. This technique helps to prevent migration of the flap and also to prevent any excessive trauma to the macular region. At the end of the surgery, I do a fluid gas exchange and put gas. Macular hole post silicone oil removal is stained after a fluid gas exchange. A free flap is used, ILM flap is used to plug the macular hole, followed by injecting a drop of viscoelastic over the ILM flap to retain it in its place. Subsequently, fluid gas exchange is done again and window laser is performed and eye is left with gas. Fluid gas exchange being done through it to settle the retina. Subsequently, the ILM is stained with brilliant blue dye. A bubble of PFCL is injected over the macula to keep it stabilized. And then ILM peeling is performed under PFCL. Here we can see that I am performing an inverted flap technique. ILM is peeled 360 degree around the macular hole, keeping the ILM rim intact at the edge of the macular hole, and it is then stuffed inside the macular hole, following which a small retinotomy, peripheral retinotomy is made and fluid gas exchange is performed to settle the retina. Care is taken not to dislodge the ILM flap by doing a fluid gas exchange carefully through the nasal side of the optic disc. Endo laser is performed to the retinotomy site as well as 360 degrees over the edge of the pre-existing belt buckle indentation. Silicone oil is injected